Oh, she's having some amount of open bite. So for that, because it was a sag and it was this, so you need to put some. You've not removed those eyelids also. So we should remove the eyelids and put elastics. So it comes up a little bit. This one needs to come up. And then we can send her off. But you can discharge her surely today. Remove everything. And it's soaked already. We have a pre-op. Sorry. Much. So we've just done Bijaw surgery for her. This is day 5. It was a facial asymmetry correction, jaw surgery, both upper and lower jaw surgery. And sorry. Nera pari kilava. Kannadi pidichuko. Odar moodi vai. And so we worked on the lower jaw. And this was really protrusive. We've taken it inside, we've rotated it, and so we've taken it inside asymmetrically. Then we worked on the upper jaw, brought it forward, and we're also going to put it on some braces treatment after a few months. And by that time, the occlusion will settle. In a while, we're going to show you how she looked before we started. Come. So you can see that. There's a huge issue. You're now seeing the side view where the lower jaw seems to be sticking forward and she classically has an underbite, so to say, in layman's terms. But you look here, that's the dental issue that also we're going to do finally. And that's the asymmetry you can see. The lower jaw was twisted out and that has been fixed as well already. There's still swelling. Look at this now. You can appreciate once again the asymmetry. You can see how it was come out more on this side, the chin, the entire face was queued up, the middle third, the lower face, and now you can see this has come out. So we worked on the upper jaw, worked on the lower jaw, angle, cheek, and this is still early days. It's just 5 days up. Side la parma. And one more time, the side view for you. You can see this, and the front view. Ask Sarah to remove the